If you're over 70, what I'm about to share could save your life. And I know that sounds dramatic, but here's the truth that most doctors won't tell you. Some medical tests that were helpful when you were younger can actually cause more harm than good after 70. Today, I'm revealing the 5 medical tests you should seriously reconsider based on guidelines from leading medical organizations and geriatric specialists. Welcome back to the channel. I'm your name, and if you're new here, this channel is all about evidence-based health information for seniors who want to live their best years with clarity and confidence. Now, before we dive in, I need you to understand something critical. This video is not about avoiding all medical care. It's about making smarter, more informed decisions with your doctor. So make sure you hit that subscribe button and turn on notifications, because we're going to have some honest conversations about senior health that you won't hear anywhere else. Here's something most people don't realize. Medical guidelines are not one size fits all, especially after age 70. What works for a 50-year-old can be dangerous for a 75-year-old. Your body changes, your risk factors shift, and sometimes the stress, radiation, or complications from certain tests outweigh any potential benefit. Major medical organizations, including the American Geriatric Society and the U.S. Preventative Services Task Force, have published guidelines specifically addressing this issue. Yet many doctors still order these tests out of habit, or because they're worried about liability, or simply because it's what we've always done. So let's talk about the 5 tests you need to discuss very carefully with your doctor if you're over 70. Number 1, routine colonoscopy screenings. Now, before you click away thinking I'm telling you to ignore colon cancer, hear me out. Colonoscopies are excellent screening tools for people in their 50s and 60s. But here's what the research shows. If you've had regular colonoscopies with normal results throughout your life and you're now over 75, the risks may outweigh the benefits. Here's why. A colonoscopy requires bowel preparation that can cause severe dehydration in older adults. The procedure itself carries risks of perforation, bleeding, and complications from anesthesia. And here's the key point. Colon cancer grows slowly. If you're 75 or 80, a polyp found today likely won't become life-threatening cancer within your lifetime. The U.S. Preventative Services Task Force recommends against routine screening after age 75 for people with prior negative screenings. They state the harms outweigh the benefits. Now, this is different if you have symptoms, a family history, or previous polyps. Those are different conversations. But routine screening, that's what needs reconsidering. Number 2, annual mammograms after 75. This is controversial, but let's look at the evidence. Mammograms involve radiation exposure. They lead to false positives, which means more biopsies, more anxiety, and more procedures. And here's what studies show. For women over 75 with no symptoms and average risk, annual mammograms don't significantly reduce mortality. In fact, they often find slow-growing cancers that would never have caused problems in your lifetime, leading to treatments that do cause harm. Chemotherapy, radiation, surgery, these have serious side effects. The American Cancer Society says the decision to screen should be based on individual health status and life expectancy, not age alone. If you have other serious health conditions, limited mobility, or a life expectancy under 10 years, aggressive cancer screening often does more harm than good. Again, this is about informed decision-making with your doctor, not blanket avoidance. Number 4, PSA testing for prostate cancer. This one affects men over 70. The PSA test measures prostate-specific antigen in your blood, looking for signs of prostate cancer. Sounds good, right? Here's the problem. PSA tests have an extremely high false positive rate. They find abnormalities that lead to biopsies, which can cause infection, bleeding, and pain. And here's the critical issue. Most prostate cancers in men over 70 grow so slowly they'll never cause symptoms or death. You're far more likely to die with prostate cancer than from it. But when a test comes back abnormal, it starts a cascade of interventions, biopsies, radiation, surgery, all with side effects like incontinence and impotence. The U.S. Preventative Services Task Force recommends against PSA screening for men over 70, stating the harms outweigh the benefits. Many men undergo painful treatments for cancers that would never have affected their quality of life. Number 4, routine annual EKGs and stress tests. If you have heart disease, symptoms, or risk factors, these tests are valuable. But for asymptomatic people over 70 with no cardiac history, routine screening with EKG